has been 4 months since the first case of COVID-19 was detected in Wuhan, China, and reported to the World Health Organization. Since then, what began as a local outbreak has turned into a worldwide pandemic. There's hardly a person on earth whose life has been unaffected by the spread of the coronavirus. Millions have been infected, almost 200,000 died, billions have had to adjust to a new life of social distancing. Welcome to this Voice of America virtual town hall, Coronavirus, Global Expert Answer Your Questions. And I'm Tatiana Voroshko. While the United States and several countries in Europe have been hardest hit, the virus is growing in Russia, Mexico, Bangladesh, and other countries. In many countries in Africa, Asia, and Latin America, the lack of testing makes it difficult to measure the spread of the pandemic. Social distancing measures that work in some countries may be difficult or simply impossible to implement in others. And at a time when China and some European countries are returning to some semblance of normalcy, a few African countries have recently identified their first cases. To answer your questions about the pandemic, experts from around the world have joined us for a virtual discussion. Please welcome from India, Dr. Pritima Chanana, Senior Anesthesiologist at the Fortis Memorial Research Institute. From Bangladesh, Mejadi Sabrina Flora, Director of the Institute of Epidemiology, Disease and Research. From Taiwan, Dr. Chan Cheng Chen, Dean of the Taiwan University College of Public Health. And from the United States, Dr. Boris Lushniak, Dean of the School of Public Health, University of Maryland. Thank you, panel, for joining us. And Kate Lister, President of Global Workplace Analytics. Kate will join us later in the broadcast to discuss workplace practices and the coronavirus. Thank you all for being here. During the show, we will talk about public health measures to contain the spread of COVID-19 and the treatments and challenges of reopening economies. But first, let's go back to the emergence of this pandemic with a question from the global audience. Let's take a listen.
Hi, my name is Simeon Pongwan from Mozambique. It has been said that coronavirus has been there for a long time. So I would like to know what caused the outbreak of this virus this time.
Dr. Lushniak, you began your career in the Epidemic Intelligence Service. What can you tell us about tracing the origins of the coronavirus?
Well, it's interesting. The coronaviruses have been part of our ecosystem for a long time. Usually we see the coronaviruses actually within the animal population. Right now we've had 7 different coronaviruses that have actually caused diseases in humans. 4 are very well known to us. So 4 coronaviruses that in essence cause the common cold. So about 20% of all common colds are caused by the 4 coronaviruses. There were 3 recent coronaviruses, all 21st century viruses. One caused the disease SARS, severe acute respiratory syndrome, the other one MERS, Middle East respiratory syndrome, and the third one causing COVID-19. And these 3 all came from the animal population. What we see is changes within the virus itself. There are mutations and subtypes that develop, ultimately a connectivity between the animal world and the human world. It then spreads to a human, and then further changes within the virus that potentially cause human-to-human transmission. And that, in essence, is what we have seen with COVID-19. Now, this brand new virus was first identified early in January as a brand new virus. The cases that we have seen probably go back into December, perhaps even into November in China. But obviously, we've seen incredible spread throughout the whole world since then.
And just as you mentioned, since the virus emerged, we have learned a lot about how it spreads. But new information is still coming. Let's take another question.
We
are ordered to stay home to prevent the spread of the virus. We still have to go to the market to buy foods or to a pharmacy to buy medicine. Some of the people who work at these shops and pharmacies are not wearing protective equipment. Then we get back to the house and stay with our families. In this situation, how much are we really protected?
If I can address this question to Dr. Chanana, Similar question, say I like to run or walk and I'm hesitant about going outside. How can we practice social distancing if there is a chance of running or walking through someone else's droplets?
In this scenario, definitely we should maintain a social distancing. That is the best way to stay away from the COVID-19 infection. Other things like in these scenarios that we cannot maintain social distancing, we should wear mask all the time, and we should maintain the proper hygiene. We should wash hands when we come back home after the visit to the market, and we should wash our hands with the soap and water. That is fair enough to get rid of this virus. And definitely we should wear mask all the time when we are out.
If we may, we just discussed a little bit about mutations with Dr. Chan. If you can tell us a little bit more, because Taiwan was the country which first experienced, one of the first countries which had to deal with outbreak.
Yeah, we have very limited cases in Taiwan, so unlike other countries, they can have a lot of samples to study. But we did cultures as many virus we can have. And so far, we haven't seen a big difference from our cases, and many from China in the beginning. But later, we have more cases coming back from Europe and the US. And we haven't found yet, but we hypothesize that we will find some difference among them. But the symptoms are also a little bit different. In the beginning, the people who got the virus has more cough, fevers, but later on we have more cases of loss of taste. So apparently the virus are attacking different parts of the bodies. So this kind of phenotype that of the symptoms that from infections would be also useful for us to know about whether this virus has been mutated to some extent. But basically, they are still the same. So we think that in the future, if we can have a vaccine, that the vaccine should be useful for all the populations and probably for all the ages. And we'll see. That's still under development, and hopefully we can have some successful vaccines coming out soon. Yeah.
Except the vaccine, it also brings up the issue of immunity, and one of the most popular questions.
Hi, I'm Marta Mazreku from Pristina. Can COVID-19 be taken for a second time, and does it gain immunity?
Professor Chanana, if I can address this question to you, do we have immunity, and how long do antibodies to the virus last if we have them?
Any viral infection creates some antibodies in the body. So whenever this virus attack again, the antibody will fight against it. But as for the WHO saying that sometimes these viruses are not creating enough antibodies, and maybe you can interact with the mutant form of the same virus. So there is a possibility it can go to either way. There is a possibility you can catch this infection again. But in India, we are practicing plasma therapy in few patients. Like we are taking the plasma samples from the treated patients and we are giving it to the sick patients, and it is working nicely. But as far as I know, that only 4 or 5 patients we have treated as of now, and they were also with the co-medications. So there is a possibility that maybe other medications have acted too. So this is very difficult to say that patient will be immune after the infection or not.
Taiwan has a relatively low number of infections. What did your country do to control the coronavirus, Dr. Chan?
You know, we in the beginning, starting from December 31st, we used to be alerted of the cases in China. So we made decision we have to act quickly. So speed is very important for us to do. And since the cases are coming from abroad, so the best policy is to do the border control. So we control the visitors and from China. So we buy times, and in the meantime, you know, we have a lot of self-protection measures. Wearing the mask voluntarily by citizens is one very important act of our ways of controlling the infections. So it's become a nationwide movement. Everybody like to buy more masks. So the government are short of a mask, like any other countries. Then they nationalize all the productions and rations of this. So this is very important when any country who in the beginning I would recommend wearing mask is one way, and hand hygiene also. And then once you have a first case, then you have to start doing this contact tracings diligently and completely. So we combine our national health data and mobile phone data to do digital tracings. So we find cases, isolate cases and transfer them for further treatment. So this is also very important. Then when the cases become more and more, you have to do social distancing. And as we learn from a lot of outbreak from other countries, religious activities and mass gathering is very risky. So we start having this kind of measures of slowing the opening of school, delaying the opening schools, and also ban big gathering. I think those are very important. We call soft social isolations, and we are not doing lockdown. We don't want to do lockdown. So if you do this earlier, when cases are very limited, you have to do it. Once cases are too many, it's too late.
Can I interrupt you? You mentioned face masks, and medical authorities in the United States initially discouraged healthy individuals from wearing them. Dr. Lushniak, do you think that was a mistake?
Well, it's one of those situations, I think, where we keep learning more and more about this virus, its transmissibility, and what are, in fact, the protective measures that need to be taken. Face masks have not been part of the culture within the United States as a form of infection control within our population. And I think in retrospect, we would have done this much earlier had we known about the sort of transmissibility and the infectiousness of this. It's interesting because even the theory of face masks is not so much for me to be protected against others. It's for me to protect others. That is, a face mask prevents the transmission from me to you, not necessarily from me getting it from others. And I think that's a critical feature in terms of the use of face masks in the United States. We've gone from not recommending, and at some point we actually had massive shortages of the certified face masks, the N95 that are usually used for healthcare workers, even the surgical masks. Now we've turned in a matter of weeks to a society where people are sewing their own masks, and in fact government authorities at the state and local level, and even at the federal level, are recommending the use of masks when we're going out to public. So I think this is a sense of the vibrancy of public health. That yes, we make decisions, but once we have further information about the spread of this disease, we in essence have the ability to make those changes within our society. So we are now priming into the world where face masks are taken as part of the response to COVID-19.
Professor Flora, how much of a challenge is it for Bangladesh?
It's really challenging. As you say, that Bangladesh is a very densely populated country. So far we are observing having some incidents of not complying with the social distancing measure in Bangladesh, but most of the people are following that. We could observe some of the people, those who are going out for shopping or other purpose, but most of the people are following that. But it's really being challenged for us, because we are a densely populated country. And also we can, in one measurement we saw that in an international scale, it is the stringency scale says that we are 95% good in maintaining this social distancing. But at the same time, I would also say that because Bangladesh is a developing country, it's being a challenge for our economy also to keep close all these factories and all these economic activities. So it's being a challenge, but so far we are following. I don't know how long we will have to follow it, but it's being a challenge.
But at the same time, cases of COVID-19 in Bangladesh are not that high compared to its population of 165 million. How do you explain that, Professor Flora?
I think we started this social distancing very early. When we were getting a few number of cases, our measures started. So that can be one of the reasons which kept our number of cases lower. And also, we don't know about the virus strain, what's the characteristics of the virus, which kind of virus is available in Bangladesh, what's the characteristics of like genetically how it's working. So we don't know that. Still, we don't have any sequencing data. We are in the process of having that. In that case, we'll be able to say how it matches with the strain of other countries. Then we can say. But as a whole, I think it's one of the outcome of our early preventive measures. We started our activities when we first saw cases in China, in Wuhan. So from that time, we started our activity, and our measure was to identify the cases as early as possible and isolate them. And we followed that from the very beginning. As you know that its contact tracing is very important. Our first cases were imported from the affected countries, and we did our contact tracing from the very beginning. We tried to keep them in quarantine, although we followed home quarantine mostly, which is more suitable for us. So I think because of these early measures, we did a lot of screening. Because of those early measures, probably we are getting less number of cases.
There's another popular idea, at least on social media, which explains low number of cases in some countries. Let's take a question from Bangladesh.
I'm Hawa Begum from Bangladesh. We hear people who took BCG vaccine are less likely to be affected by COVID-19. Bangladesh has BCG vaccine program from long before, but yet people are getting infected and dying from it. I'd like to know, is it only a perception or is there any evidence?
So, Professor Flora, do BCG vaccines against tuberculosis work?
Actually, so far we know, although there are some literatures saying that BCG vaccination might have any role in preventing COVID-19, but so far, if you follow all the advices of WHO ruled out that. So, to me, I don't think it gives any kind of protection, because BCG vaccination is against a bacteria and it's a viral infection. So a lot of things we are saying, but still a lot of things are left to know about this virus. So in my opinion, I don't see any kind of relationship with this BCG vaccination and this prevention of COVID-19.
Thank you. Dr. Lushniak, can we at this point compare different approaches around the world and make a conclusion about which strategies work and which don't? I know it's a huge question, but if you can give us some highlights.
Well, I think it's a little early to sort of come up with conclusions right now. Don't forget that as mentioned earlier, the virus was first discovered or first reported to the WHO office on December 31st, 2019. So we're just 4.5 months into dealing with a brand new virus. It is interesting, however, that the epicenter went from China to Europe and now to the United States, where the next epicenter is to be determined. But because of that sort of approach, if you will, everyone's looking back at past epicenters. So in essence, we are learning from Wuhan in terms of what worked and what didn't. We are looking to Asia of what worked, and didn't. We are looking to Europe of what's been working, and now we'll be learning more for the United States. The reality is that everyone had a slightly different approach on this. We were all trying to do social distancing, perhaps at different times. The other non-pharmaceutical interventions, such as washing the hands, disinfecting, making sure that we kept our hands away from our faces, and staying away from others when sick. But don't forget that there's always new information coming out in this short time period. I think a major change for us was the idea that so many people were in fact carrying the virus and were spreading the virus, but were totally asymptomatic. And so I think these various approaches need to be compared. We need to be able to share information internationally. under the leadership of the World Health Organization, we need to be able to prime in on what works and what doesn't work, but that still is to be determined.
Even and when those drugs are approved, it will still take time and money to make them available worldwide. Dr. Chanana, what is the current situation with drugs, treatments and hospital bed availability in India?
In India, definitely there is no pharmaceutical product have yet been shown to be safe and effective for the treatment of COVID-19. However, there are a number of medicines has been suggested as potential investigational therapies, many of which are now being will soon be studied in clinical trial. In India, we are using hydroxychloroquine and in limited manner in control observation, and plasma therapy we are using, and antiretroviral medicines we are trying. As per WHO cautions against physician or medical practitioner that we cannot recommend these medications without any evidence, but definitely there is one terminology which is called as emergency use authorization. So we are taking consent from the patient and we are using these medications. As of now, we cannot recommend any of these medications for the treatment of COVID-19 because these medicines are under trial and we do not have enough data to prove it. But definitely, people are working on these. Even WHO is doing a trial on 4 medications like antiretroviral, hydroxychloroquine, and even interferon beta 1 and remdesivir. These are the medications which are under trial, but as of now, there is nothing proven. So WHO is working on trial. Whenever the trials reach some conclusion, it will be out.
But in your medical practice, do you deal with self-medicating and self-medicating going wrong? Do you have this
Definitely, it is not at all recommended because there are reports that people have faced some harmful side effects, even the death because of the hydroxychloroquine, because they were taking hydroxychloroquine as well as azithromycin all together, and both of medications can lead to increase the heart rate, very rapid heart rate, which can lead to ventricular tachycardia and ultimately death. So these self-medications are not at all recommended. But I would like to mention one more thing, that patient already taking these medications for other issues like autoimmune disorder, they should continue taking their medicines and do not stop taking your medications without consulting your practitioner, and even do not take these medications without prescription.
Professor Flora, new cases in Bangladesh are still rising. How are your hospitals holding up?
As because Bangladesh has a resource limited country, so we are scaling up day by day. So we started with designating different hospitals. Actually, we started with having isolation unit in every hospital. Then gradually we started to have designated hospitals. So when we are getting increasing number of cases, next we are moving to next hospitals. Now, as because we have more or less 6,500 cases, now we are developing different makeshift hospitals. We are trying to manage all those services, but 2/3 of the cases are actually in home isolation. Those are really very, very mild cases. And we are providing them services through telemedicine, and also our team is calling them, giving counseling, and also kind of mental boost up. In that way we are treating, but it's being a challenge. It's being a challenge all over the world. So Bangladesh also is facing a lot of challenges, but at the same time, so far we could offer services to many of our most of our patients, but we are not getting that much severe cases. Mostly they are mild cases. Even those who are hospitalized, many of them don't need hospitalization, but I think it's been a challenge both in Bangladesh and India and some other countries like us, where stigmatization or discrimination is little bit there. So in those cases, when they are not allowed to stay at their home, in that cases, even if they are mild cases, we bring them to hospitals for isolation. Other than that, as I mentioned, we are scaling up our preparation every day. We are adding our services. So we hope that we will cope with this situation.
But what about ventilators? Does Bangladeshi hospitals have enough of those?
We don't have enough ventilators, and as you know that only 2 to 3% patients may need ventilator support. But even then, we are in the process of developing that. We are increasing our ICU beds and also procuring ventilators, increasing our ventilator supports day by day. As I mentioned, that we are scaling up every day our services. So still, we hope that we will be able to cope up.
The lack of ventilators has been an issue in the United States. At the same time, the National Institutes of Health issued guidelines advocating for the cautious use of ventilators. Dr. Chen, what was the Taiwanese experience with the ventilators?
Yeah, we have sufficient ventilators and already, but our experience is better not to use a ventilator. That's if we can treat patients earlier. So in Taiwanese experience, every confirmed case will be put in the hospital right away, and monitoring their situations. And so a lot of them, they don't need to go to the ventilations. We just supply oxygen and some supporting treatments, and let them stay in the hospital as long as they can, and some of them will stay around 21 days, So, and for those who are on the ventilators, our success rate is quite good, and we'll even use some ECMO and try to support the patients. And some of the patients, actually, they can recover and, totally and put off these intubations and discharge. So ours limited experience because our case is not many, and it's better not to use the ventilator too early. Then probably the outcome will be better. But we don't know whether this kind of model can be applied to places with a lot of cases like New York. That will overwhelm our medical capacity. So far, our ICUs are still under control, and so this is the Taiwanese experience. Maybe we can share this with all of you. Yeah.
I'd like to address similar question to Professor Lushniak. Does U.S. medical community came to the similar conclusions, trying to not to use ventilators if only in the cases then absolutely necessary?
Yeah, I think so. I mean, certainly when we were projecting the numbers in our epicenter here in the United States, as mentioned in New York City, there was a fear factor that we would run out of ventilators if, in fact, they were overutilized in the intensive care unit scenario. Certainly, the intensive care units were filled to capacity. The ventilators were utilized. However, I agree with the idea that, in essence, and that's the usual sort of methodology in critical care medicine, really putting out a person on ventilatory support is really kind of a severe measure to take. And if there are measures that can be done beforehand, those may be more life-saving than putting persons on ventilators. But right now, although we were fearful of shortages of ventilators in the United States, I think certainly the New York model showed that there was a ramping up of number of ventilators, and pretty much that we did okay. Not great, but we did okay on that. But there is a reflection on where ventilators really play a role in terms of therapy for COVID-19.
And even before vaccines were being developed, countries such as Germany, Austria, Norway, and South Korea slowly eased lockdown restrictions. Here's a question from Serbia.
Dear ladies and gentlemen, my name is Vanessa Strojic and I am from Belgrade, Serbia. My question to you is there a plan, and what is it for the next phase now, where people will be slowly returning to their regular lives, going to work, etc., after the quarantine, so that the virus is not spread more and for people not to get sick as much as possible?
Dr. Chen, you mentioned that Taiwan never went to the full lockdown, but still, in your experience, how did this easing was going on?
You know, one thing we worry most about is in the future, if there's a lot of lift of the lockdowns and international travel will be become more frequently, then we have to enforce some kind of border control. But this time we cannot ban. So probably we will rely on testing, more testings for the visitors. So same as our internal mobilities, and we are thinking of combined antibody and this RT-PCR testing together to do this community-based sampling and try to get a sense the real infection rate we have. But our government has not made the mind yet. But so far, because we are soft social distancing, and so I think the mask should be well until we have a vaccinations. I think this is one, and we try to cut down our mobility by half. That means, you know, we have to ask probably still half of the population work from home. And the schools, you know, we will use at least half of these remote teachings, and whether we can have on campus, always as we have now, we will look at the epidemic curve globally, regionally, and nationally to decide it. So I think the mask wearing would be one of the key roles to play in in a crowded society like Taiwan or Bangladesh. We have to use this daily to in public, indoors and outdoor. I think this is the only way we can do it. And if in the future the testing kits can be cheaper enough and widely available, that would be used. And once we know this prevalence of infected or currently infected populations in our society, probably then we can start losing all the restrictions. So in the new normal society, I would think the way we wear, the way we do the transportation will be very different from before, and we are still thinking of that and creating a situation that people feel safe to have a normal life. Yeah.
So it appears that masks are here to stay. In India, lockdown measures were extended from May 3rd, which is just around the corner. Dr. Chanana, do you think India will be ready to open its economy in just a few days?
Definitely India is not ready to open it as of now, because the number of patients are increasing day by day. But yes, definitely we cannot maintain it for the long time, so we have to open it in the graded manner. Like we have divided into the three areas, like it's a red area, orange area and the green area. The green area, we mentioned that if we have not reported even a single case over there, so we can open green areas after 3rd May. And definitely we have to wait for the orange area and the red area definitely. So once we open up, word will be definitely different from everyone, because we have to maintain the social distancing until we get vaccine in our hand, because vaccine is the only cure for this disease, and till 60 to 70% of population is immunized with this vaccine, we are at risk definitely. And the vaccine will take 12 to 18 months, and we cannot maintain the lockdown till then. So we have to open it in a graded manner, but definitely we have to maintain the social distancing. We have to avoid large gatherings, and definitely we have to wear the mask in the public areas. And as much as people can work from home, they should prefer to work at home. And we have to maintain personal hygiene. We have to wash hands frequently with the soap and water. We should touch surfaces very less, and if we are touching, we should wash hands. And I think word will be very different after the lockdown will be removed.
Everybody's hoping that something positive will come out of it. And let's take a question from Thailand.
Hello, I'm Nisha Pan from Bangkok, Thailand, the VOA Thai audience. I have only one question about traveling. As many countries, including Thailand, announced the ban on incoming international flights, which really affect the tourism sector. That's why I'm curious on how long it will be like this and when is safe enough that we can travel abroad again.
Dr. Chen, I'll let you answer this question and tell us expand on your understanding of the post-pandemic future.
Yeah, that's the way how we eat. Can we eat it out in the restaurants? The way we dress, that's a mask could be one part of our dressings in the futures. And the way we live and work, the working place, because of this working from home will be more frequently. And the way we travel and international travel will be changed. The airplanes, and especially the cruise, that will be changed a lot. And the way educating and entertaining will also be changed. So I see a future that during this pandemic and also after the pandemic, it will be years after the pandemic. So we are jointly creating a new society that would be somewhat different from what we used to be. And so the travel will be not like this kind of group travels and cheap airplanes, and you can make a decision today and purchase tickets and to go somewhere. I think that's probably cannot be like this anymore. So more planned schedules travel will be the kind of futures, and a lot of restrictions, regulations we have to follow that enforced by the countries and who are hosting a lot of visitors. So all of this, and I think will be good things for us to learn from this pandemic to avoid another big impact of future pandemic. So I'm optimistic that we can learn a lot from this and accustom to this and survive this and even prospers in the futures.
And let's take the final question from Kabul, Afghanistan.
This is Rahim Golsarwan from Kabul. My question is, for a much well-organized, generously funded, and a worldwide joint efforts against Corona, how necessary it is for all countries and governments to come together and join forces.
And Dr. Flora, I'll address this question to you. How important it is to join forces and what kind of future you see for Bangladesh as well?
I think it's very important to work together. And because it's a global concern, so every country should work together to overcome this situation. And it's a global crisis. And also, although we do not have much cases so far, but you cannot say anything. There is a lot of uncertainty with this virus. So we don't know what would be the impact on the economy of Bangladesh, but definitely it would be a big challenge for Bangladesh as it is in any other countries. So as a whole, I think to overcome this situation, we need to work together, every corner from within the country and also other countries. And there are many issues, and nowadays it's one world, if we could say in that way. So to overcome this situation, we will have to work together, not only to combat this COVID-19 situation. I think during the post-pandemic situation also, we will have to work together as one force. Otherwise, it will not be easy to overcome the economic loss, and also the life loss so far we have worldwide. So it's really important.
But you still believe that something positive can come out of it in terms of international cooperation?
Definitely, every crisis brings some opportunity also. If we can take that opportunity, utilize this opportunity to come together, to work together, that would be definitely useful for all of the countries.
And I think we discussed all the issues which are extremely important. Thank you, panelists, for your time and expertise in this insightful and very important discussion. We hope your countries reach the end of this difficult journey stronger, wiser, and more united. And now to discuss the future of our work lives is Kate Lister, President of Global Workplace Analytics, a research and consulting firm that helps employers understand and prepare for the future of work. Kate, welcome. My first question is, what impact will the pandemic have on workplace practices?
It'll have a big impact. We're going to see a lot more people working remotely. We've been doing some surveys around this. A lot more people, about 80% of people are working from home now compared to something less than 10% on a regular basis. And interestingly, they all want to continue to do so. So a lot of people who didn't do it before and now have had the experience want to continue to work at home.
You said 80%, but what percentage do you think would stay?
My own prediction is somewhere around 30% of employees will be working from home multiple days a week when this is all over. I mean, I think there's going to be a period where they want to go back to work. They want to be with people that speak in full sentences rather than their children. But I think after that, there will be a desire to continue working from home. As I say, multiple days a week. It's not an either or. It tends to be something where that half time is kind of the sweet spot.
But how the pandemic will change the work we do at the office?
This is a trend that really had already begun maybe 5-10 years ago, where offices are being completely reconfigured to be the place of collaboration and home the place of concentration. So I don't know if you've experienced it, but a lot of people find they're more productive when they're at home. There are fewer interruptions, and so they're just able to concentrate better. And companies have realized this already. Large companies have completely changed their office design so that there are places for teams to collaborate and social areas, but not a lot of private space and not a lot of assigned desks. So you come in and you work wherever you need to work to be effective. Now that's going to change a little bit when we go back also.
And in which industries do you expect the highest growth of telework?
Right now, healthcare, believe it or not, not in terms of the practical part of it, but in terms of the administrative part, is one of the leading industries. Of course, IT, as you would expect,
right.
Administrative jobs, also call center jobs and customer service jobs. They've been doing remote work for more than a decade, and I think we'll see an increase there as well.
I know it's a huge question, but if you can answer shortly, what would be the benefits of adopting telework on a larger scale?
People, planet, and profit. So for the people, it gives them back their time. They would have otherwise spent commuting an average of 11 days a year that they would have otherwise spent in traffic. They get to save money, and it reduces stress. From the employer's point of view, increased productivity, better attraction and retention. This is something people want to do. Reduced real estate costs and greater sustainability. And from the planet, again, the greater sustainability. We've seen the air clear up in a very short period of time, so we know that reducing commuter travel is important.
What about our lives outside of work? Will we socialize differently?
I think for a time we will. I think anybody that has a compromised immune system is going to want to continue to work virtually. In fact, as companies are planning to bring people back, they're not planning to bring all of them back right away. It's going to be a phased approach. And anybody that has, as I say, an autoimmune problem will be allowed to continue to work at home. Same thing with the social distancing with our friends. Maybe we'll actually see less of our friends because we're so tired of being on Zoom all day long. I know, speaking for myself, it's very difficult to get up for an evening Zoom call after I've just spent the whole day on it.
Thank you, Kate. Let's hope we will be able to see our coworkers, friends, and neighbors in person soon, and maybe shake a hand or give a hug. This has been the Voice of America Virtual Town Hall, and I'm Tatiana Voroshko. Please stay healthy, safe, and informed. Goodbye.
For
subscribe, and press the bell icon on YouTube app and never miss another update.